Hey everyone, I'm going to review this PowerPoint, developing adaptations to promote participation in inclusive environments. If we think back to the definition of special education and how specially designed instruction, what that actually means, it means that we adapt as appropriate to the needs of the child, to address the unique needs of the child's disability, and to make sure that the child can access the general curriculum. So when we're thinking about actually identifying and developing these adaptations, we think about these questions. What are the students' capacities, needs, and high priority educational goals? What environments to be selected for instruction that promotes the achievement of these goals? You clearly have to understand the capacities, needs, and the educational priorities for the student. You have to think about the home, school, community, and vocational environments in which a child operates. Activities and skills that are necessary to participate in the selected environments, and then the ability of the student with disabilities to engage in the required activities and skills are assessed in the actual environment. And then, of course, the performance discrepancies are identified and analyzed. So this is what we've talked about this semester, about making a plan, evaluating the plan, and always doing what's best for the student. So when we're thinking about performance discrepancies, we have to think about student learning factors, instructional factors, sensory, motor, and physical factors, motivation, and environmental. You ask yourself when you're thinking about selecting adaptations for the student, does the student have unique learning characteristics that prevent them from engaging in specific steps? An example of that would be short-term memory loss. Brief short-term memory means that the student would be unable to perform multi-step instructions. Therefore, you would modify or make some type of adaptation for their learning. Instructional factors: does the kid need more time to take the test? Do they need bigger print? Do they need the test read aloud? These are common adaptations for instruction. Now, what about physical, sensory, and motor? Does the child have endurance issues? What about sitting and standing? Does the task need to be tactile, visual, or auditory? And then what are the student's preferred movements? Motivation could be something as simple as, is the child motivated by working in a pair? Do they need a preferred activity coupled after they complete task? Is it scheduled at the right time for the child? Is it a peak time? And then environment is, do they have access to the environment? Is it cluttered or confined for the student? I've showed you guys this picture before. This is a picture of a desk with lots of teacher materials on it. And it says, does the teacher have access to necessary materials? Well, this is an environmental factor, and do you think that the student has access? Absolutely not. Are there inappropriate behaviors that are interfering with the performance of required skills? And this could be a motivation factor. There could be tons of behaviors that interfere with performance of required skills, such as you got the wrong boy sitting beside the wrong girl, or you have little girls that aren't, or girls that aren't getting along, and you have them beside each other. This could be just inappropriate behaviors that interfere with the performance of their required skills. So as a teacher, we have three options. Teach directly, which means that whatever the skill is, you teach it to you teach the student the same way you would as a child without a disability. The second one is make some kind of instructional adaptations or just modify the requirement of the task. Or the third option is have some type of adaptive material or device, something different. First example of an instructional adaptation is scheduling. For example, just give the student extra time to complete the task, break the testing up over several days. Scheduling has to do with time and instruction. Second would be setting. For example, working in a smaller group, working one-on-one with the teacher. A lot of times students are pulled out to work one-on-one with teachers with literacy and things like that, so that is a setting adaptation. The last is, another one is materials. We can make instructional changes or modifications by providing audio, tapes, books on iPads, copies of the lecture notes, large print books, Braille, books on DVD, iBooks, Google Books, Kindle, all of those type things are material adaptations. Adaptations to instruction include reducing the difficulty of the assignment, reducing the reading level, and then using someone like a student peer buddy to help the student. How the student answers your question. In class we use response cards sometimes, and that is a student response. Allowing answers to be given orally or written, using a word processor, and then using sign language or some other type of picture device or communication device. All of those are student responses. Alright, so an example of adaptive materials would be portable objects, equipment, instructional materials individually designed for a student. I have a case study on a student named Claire that we'll talk about in class next week, and what some adaptive materials that help make her successful in a regular ed classroom. This is a picture of a menu, and this is specially designed for this student because it has the words and the pictures on the menu. Assistive technology, we have assistive technology services and assistive technology devices to help students with disabilities. So for activity for this lecture, I want you to look at the next slide, and there's a picture of a classroom using adaptive devices, and I want you to list all the adaptive devices that you see, and we'll have a discussion on that on Monday. Well, I said Monday, but I meant Tuesday. And actually, if you look at the picture, you're going to see that there are tons and tons of things here that are assistive technology. And so you have a calculator, computer, those type things, but there's also some other things that the teacher is using here that are adaptive materials. So you just want to look at those closely. So whenever you are considering your adaptations, you want to think about how you're going to teach the skill, what the student preference is, how to increase their participation in class. Very important here is whatever you decide to use, are they going to be able to continue to do this? Are other teachers going to be able to implement whatever you've changed about the way the student gets their information? And then, how does that affect their physical movement demands, and then the design and construction demands? Pretty important factor here is that it's for one student. Use systematic instruction to teach the child how to use that adaptation, but adaptations don't replace instruction. It's to help the students. An example of overgeneralization of adaptations. It came out, students with disabilities that had fine motor skill issues couldn't use the combination locks, so they had key locks. So you could go and look at the lockers and decide which kids were EC and which kids weren't, when in fact all students didn't need the special lock. It's just that all students with disabilities ended up getting that special key lock, and that would be an example of overgeneralization of an adaptation. You want to continually evaluate the assistive technology and adaptations that you're using. You want student feedback to determine if the student likes it, if it's helpful, if it's useful and relevant. You want to observe the student using it, see if the student is engaged and interested in using whatever it is that you've put in place, and then always collecting data to determine if it's helpful to the student to perform the intended task. General education teachers should always understand that the outcome of the assistive technology is to measure the classroom-based content. For example, if a student is using a calculator, the measurement of progress should be related to the child's ability to complete the assigned work, not the ability to use the calculator. Some interventions that I thought would be useful for you guys to think about when thinking about your in-depth study report. These are special education interventions that improve the learning of content, mnemonics, graphic organizers, learning strategies, computer-assisted instruction, peer tutoring, cooperative learning, study aids, hands-on learning, and explicit instruction. All of these are used in different areas of instruction and with students with different disabilities. So if you're interested in any of those contents, think about those for an area of disability. I don't know if you guys clicked on this link before to watch the little YouTube video, but it is pretty cute. And I hope that I cleared up some of your questions on the instructional adaptations. The other part is physical management, so I'll talk a little bit more about that. But out of this lesson, I know that I covered the same things that you did for your study guide and your guided notes the first time, or just the study guide. So I want you to think about instructional adaptations, and maybe we'll have a discussion on this part on Tuesday.